My name is Dr Emmaline Ashley. I'm an NHS and cosmetic doctor, and I have my own boutique private medical aesthetics clinic in the heart of Mayfair, London, Ashley Aesthetics. Today we're going to talk all things chemical peels. So what is a chemical peel? Chemical peels are actually a very clever little bit of science where we're using very specific and tailored ingredients to exfoliate the skin and stimulate new cell growth. Now, the top layer of your skin, which is the layer that you can see and touch, consists of tightly packed non-living cells. And chemical peels will gently unglue some of these extra cells, allowing them to slough off and revealing a smoother layer of skin underneath. Now, chemical peels are also controlled chemical burns, which is why for medium depth or deeper peels, usually you need to be seen by a medical professional to do these safely. But what we're actually doing is we are causing temporary and very controlled injury, and what this actually does is it stimulates all that beautiful new cell growth and collagen production, which is what gives you that beautiful glow once you've had your peel. Why are chemical peels good? Chemical peels are great because they are a good low-risk skin treatment that can give your skin that little extra boost that it needs. Now, I always say there's no point in spending money on a chemical peel if you're not supporting that with a really good, high-quality, consistent skincare routine at home. But what a peel can really do is push your skin forward in maintaining all those benefits that you get from a good skincare routine. And it's wonderful at tackling specific skincare concerns like hyperpigmentation, acne, or rosacea. So what chemical peel is good for wrinkles? Now, chemical peels can't get rid of really deep wrinkles, but they certainly have a brilliant anti-aging effect, and they can be very effective for more superficial wrinkles or fine lines. If you're tackling these skin concerns, you're probably going to be looking at a more medium depth peel, so something like a TCA peel or Jesner's solution are really good options for you. So what is a TCA peel? TCA stands for trichloroacetic acid, and it's one of the oldest peels around. It started being used in the 1890s. It's a very versatile peel, which is why a lot of clinicians like it. So you can really vary its strength depending on the percentage of TCA that you're actually using, and it can really be tailored to your specific skin concerns. Now, it penetrates deeper than most standard alpha hydroxy acid peels, so it tends to be a more medium depth or deeper peel, which is why you really want someone who's experienced and knows what they're doing. It's a great peel for things like acne scarring, sun damage, and lines. Are chemical peels good for hyperpigmentation? Yes, chemical peels can be absolutely brilliant for hyperpigmentation, but this is where you need to go to someone who's really experienced and is a skincare clinician, because patient selection is key for this. In a lot of patients, and particularly in patients with skin of color, if the skin is not adequately prepared and prepped before a chemical peel, because you are causing some controlled inflammation and injury, you can make pigmentation worse or cause even post-inflammatory hyperpigmentation. So while chemical peels are excellent with hyperpigmentation, go to someone who knows what they're doing so you can get the best results. Can I do a chemical peel at home? I'm going to say no, you shouldn't be doing chemical peels at home, and I'll explain what I mean by this. I'm not talking about medical grade skincare lines that have these lovely peel pads that you can use safely at home, and I'm not talking about all chemical exfoliation, which is perfectly fine to do at home if you've been given good advice. I'm talking about a full chemical peel that you would do in a clinical setting. Now, most peels are done with eye protection for our patients, which obviously you wouldn't be able to do at home. And while they are low risk, there are still risks associated with them. And it's better to be in a clinical environment where if you do have any reaction, it can be neutralized and dealt with, and where you can be given appropriate aftercare. What chemical peels are good for acne scarring? Now, if you have really deep acne scars, a chemical peel on its own is probably not going to be enough. But if it's a more superficial type of scarring, again, you're looking at more medium depth peels to deal with it. So TCA peel is a good solution. If you are acne prone in general, there are some brilliant chemical peels out there to help with acne in patients. So salicylic acid peels are excellent. Salicylic acid is a star acne fighting ingredient. It's It's really oil soluble, so it's great. And something like malic acid if you have more sensitive skin, but that's still acne prone. So there are lots and lots of chemical peel options out there for people who are suffering from acne, so we can prevent scars from forming in the first place. What is the best chemical peel? That's actually a really hard question to answer because it really depends on your skin and what you're trying to achieve out of your chemical peel. I work with some really great medical grade skincare brands, and actually these peel systems can be really sophisticated. So when you're doing a peel treatment for a patient, often you're not just using one type of acid or doing one type of peel. You're using a combination of different acids either together or in different layers to achieve the best result for your patient. So there's actually a lot of room to play with chemical peels as you get more experience to give you the best results possible. What is a glycolic acid peel? So glycolic acid is one of the alpha hydroxy acids. It's derived from sugarcane. It's actually the smaller of the alpha hydroxys, so it's really good at penetrating into the skin. And what can this peel do? Everything. It's a brilliant chemical exfoliator for getting rid of excess sebum and dead skin cells. It targets melanin clumping, so it's great for areas of hyperpigmentation or sun damage. And it also enhances collagen production and some of the natural sugars in our skin. So remember, collagen is that protein that gives our skin its nice, youthful, plumpness, and sugars in our skin are great for hydration. So it's a great all-around peel for improving skin texture, tone, and clarity, as well as improving the appearance of fine lines and wrinkles. It can also improve acne and hyperpigmentation, as I mentioned, so it's no surprise that glycolic acid peels are one of the gold standard peels out there. Can I go to work after a chemical peel? This really depends on the type of peel you're getting. So remember, we've got a couple layers to our skin. We've got the top layer, which is the epidermis, and a dermal layer underneath. If you're getting a superficial peel, it's only affecting the very top layers of your epidermis. So these are peels with very little downtime. They're often called lunchtime peels because you can sneak off on your lunch break and get them done, and no one is really the wiser. So there's almost no downtime with them at all. A more medium depth peel is going to have about 7 to 10 days of downtime, and you are going to get side effects before you see the final results. So you'll have potentially a bit of redness, maybe some flaking, and some skin peeling. If your skin is peeling, do not pick at it, let it fall off naturally, because you don't want to cause any trauma or scarring to the area. And if you're getting a deeper peel, these are more medical peels. They're done for more medical indications, and they tend to only be done by dermatologists and plastic surgeons in a clinical setting. And so they are much more invasive, and there'll be much more downtime associated with them.